Hello, everybody. My name is Dr. Kashif Abdullah, and I thought I'd create this um, YouTube series on drug-free treatments of insomnia. And many of my patients have dealt with insomnia, and I thought, well, why don't I create a uh, YouTube series where people can listen in on some of the techniques you can use at home without any medicines. So the first thing I'd like to discuss is sleep hygiene. So there are three P's of insomnia. There is the predisposing factor. So that's at the bottom you'll see a gray kind of graph or something. That's the perpetuating, so predisposing, sorry. So everyone has a predisposing condition to insomnia. Then there's a precipitating event. That's that big up spike you see. A precipitating event might be maybe job loss or divorce or some kind of loss in the family or what have you, and that keeps someone up at night. But eventually that will subside and go away. The precipitating, if like eventually you'll hopefully get over the job loss or what have you. But then there'll be perpetuating events. So maybe you've had developed poor sleep hygiene during the precipitating event, and that will just you'll just keep experiencing insomnia over and over again. So so the goal of treatment of insomnia is quite honestly to remove or mitigate the perpetuating insomnia events. We can't change the predisposing or precipitating, but we can try to change the perpetuating. That's in the yellow graph there. So one of the first things you should do, actually, before any treatment, is create a sleep log. I will provide a link in the description below where you can have access to the sleep log. You can print it out and you can follow the directions. And this is something you should actually do before even going to a physician, just to help yourself and the physician determine what is the best method or what is your sleep cycle has been for the past 2 weeks and how to remedy this. So this is something that you should always do, no matter what, before any kind of treatment. So create a sleep log. So after that, I would like to discuss there are two forms or two legs of treatment. So you have a cognitive behavioral therapy or the drug-free, which I'll be discussing, and then you have insomnia medications. That's the Ambiens, the Trazodones, and there's a whole bunch of others. That's something that you would have to go to your doctor for. But this YouTube series will be specifically about the drug-free treatments regarding cognitive behavioral therapy. So there are multiple modalities of treatment. So you got your sleep hygiene education, stimulus control therapy, sleep restriction therapy, relaxation therapy, and cognitive therapy. I'm going to discuss every single one of these in the upcoming videos, but this video will be discussing specifically sleep hygiene education. So, what can you do for improving your sleep hygiene? Well, one of the first things you can do is avoid caffeine, specifically after late afternoon or evening. So around 5 o'clock, stop drinking any caffeine. Alcohol, same thing. Don't just stop drinking alcohol around 5 o'clock, 6 o'clock. You should just avoid alcohol beverages after then. Um, Large meals. Try to avoid large meals near bedtime because that can cause indigestion or what have you. So your largest meal, quite honestly, should be breakfast or possibly lunch and not dinner. Dinner should be the smallest meal. That's also for weight loss and what have you. Eliminating environmental noises. That can be auditory and visual. So what is like an environmental noise? So like odd noises in the room or TVs or what have you, or visual noises. What's that? That's like light, maybe light from outside. So trying to what you wanted is trying to make a dark, cool, dark room. So that's the temperature. That's my next point. Trying to, if the room is too hot or too cold, you want a nice, cool room, not too hot, not too cold. Avoid watching TV or internet in bed. This is paramount. Many of us are guilty of this habit. We're on our mobile devices. We're watching TV late night. You should not make your bed a area. You should just try to associate your bed with sleep. I'm going to discuss this specifically. This is a major thing in insomnia where we have disassociated our bed with sleep. We've made it into our couch. Your bed is not your couch. Your bed is your bed to sleep in only. So another thing you can do is to avoid daytime napping, if you can do that. And if need be, you can remove a clock from the bedroom, and that's basically if you're concentrating on always the time. That's one of those environmental noises I was speaking of. So that's a visual noise. Oh, or maybe it can be an auditory noise. Maybe it's like making a ticking sound that you're constantly hearing, or you're constantly seeing it as an auditory noise. You want to remove environmental noises as best you can. So that's basically sleep hygiene. The next series will be YouTube video will be on stimulus control therapy, and I'll see you then. This is Dr. Kashif Abdullah. Uh, Sweet dreams.